When you find out you need a hearing aid, remember that you have options on what kind will work best for you. Dr. Jody Conter, along with Dr. Rachel Conter from Gardner Audiology, are back to break it down for us. Welcome back, ladies. How are you?
Thank you. Great.
So you get the diagnosis from an audiologist like yourself, you got to have hearing aids. I know that sometimes there's a stigma associated, but it really can be life-changing in a positive way.
Absolutely.
But when you get that, you hear you've got to have it, options, what's out there, what do people need to know?
So people often come in asking about the cochlear implants because it is the one that you see people on YouTube or on social media when they turn the cochlear implant on, it's life-changing. But for the average person, that is not what they need. Cochlear implant is it is a surgery. It is designed for people that conventional hearing aids are not helping, or they're receiving very little benefit. It usually requires a significant amount of hearing loss and very little benefit from hearing aids before they go that route. The other type of surgery is the bone-anchored instrument. It is also designed for a very specific need. It could be somebody who's born with no external auditory ear canals, but their inner ear is fine. Someone who has single-sided deafness, they have one ear that has good hearing and one ear that has none. Someone who has chronic ear infections and we can't close the ear off with a conventional hearing aid. It's designed for someone with a good inner ear, but a problem somewhere in the outer ear, or the single-sided deafness.
Now, I would assume that the regular hearing aids, and I hate to kind of use that word, but the regular, traditional, conventional, thank you, hearing aids are more common, obviously. Is that correct?
Yes. I think recent numbers have shown that hearing aids last year helped almost 2 million people, whereas cochlear implants or surgical devices, it was closer to the 100,000 mark. So more people are candidates for traditional hearing aids rather than a surgical device.
Does there come a time where a person has a regular hearing aid and then maybe that stops working and it progresses? Is that
Absolutely.
what you see a lot?
Yes, I wouldn't say a lot, but it happens. You know, when someone gets to the point with even with hearing aids, they cannot understand conversation. They're becoming very, very isolated. We've tried the latest technology and it's still not having a real positive impact. Then we typically move on to the cochlear implant evaluation consultation with the surgeon to see whether they're a candidate for that.
Now, we've talked in the past about how it's so important to get a diagnosis of hearing loss with an audiologist because you're able to diagnose a lot more specific to see what people need. What about hearing aids? How do you know what's best for the individual person? Again, that has to go with your expertise that only audiologists can provide.
Yes, it's all based on the patient and what their needs are and also what their hearing needs are. So different people need different things, and that's why we go through a very detailed evaluation with the case history, the testing, so we can give the best recommendation for the patient, whether it be they need to see ear, nose, and throat physician for a potential cochlear implant or bone-anchored instrument evaluation, or proceed with hearing aids. It's hard to know unless you have that evaluation to begin with.
You know, it seems too, you brought up seeing the cochlear implants or the ones that we see videos of. Maybe you've seen them on your social networking, but you can still get dramatic results with just hearing aids. And I know you get to see that every day.
Yeah. We were talking a little bit before about how I got into audiology because apparently I'm an instant gratification kind of person, and decided speech therapy was not for me because it's more ongoing for long periods of time. But to program hearing aids and to see the positive impact sometimes before they ever leave the office. Other times it's when they come back for their first week follow-up, and to see the family's reaction, because a lot of times the patient is not so convinced that they have a problem, but after wearing hearing aids for a week, the family is like, oh my gosh.
This house. They come in very happy.
Yeah, very life-changing.
Well, in closing, let's start where it kind of started at the beginning there, where we said, getting that diagnosis of needing a hearing aid. There is a stigma associated. What do you want people to know?
Better hearing improves your life in every aspect, and there is no need for it. Everybody does what they need to do in order to live their life to the fullest. That's what it should be. And if you wear glasses, you wear glasses. If you wear hearing aids, you wear hearing aids. Our goal is for you to be able to enjoy life with the least amount of stress.
It doesn't have to be a negative. Well, if you want more information to talk with the ladies yourselves and see how Gardner Audiology can help, we'll give a call or visit their website. All of the information is on your screen.